So I'm going to be chairing today's session, which is entitled Sexual Health and Reproduction. Moving on to our first speaker then, who is Marcin Smietana. Marcin is a research associate in the Reproductive Sociology Research Group here at the University of Cambridge. His research involves qualitative interviews with British gay men who have pursued altruistic surrogacy in the UK or compensated surrogacy overseas. Which follows on from his previous EU-funded study on gay men who form families through transnational and domestic surrogacies. Marcin is currently writing a book on gay men's reproductive decision-making and the thinkability of gay family projects in the context of transnational reproduction. And his talk tonight is entitled LGBTQ Reproductive Migrations and Queer Reproductive Justice. Marcin.
Thank you, Jeff, for this introduction. First of all, thank you again to Leila, Tiffany, Jeff for organizing this special event, as well as to Nikki and CRASSH, Q+, and Sarah Franklin, SRI, Strategic Initiative in Reproduction for their support, to Professor Geoffrey for the inspiring keynote, and Natasha Tarna for the conversation. I've been really enjoying this conference, and I must say that you've introduced me in a mode of thinking and a community that I really cherish, and that is both poetic and made together by all of us. So thank you, everyone. And I'll be talking today about LGBTQ reproductive migrations, where people migrate in order to have children. And I suggest looking at these migrations through the lens of what perhaps could be called queer reproductive justice. I'll be referring to my own research on reproductive migrations undertaken by gay men, but there are some possible parallels to be made with other queer people as well. In this paper, I'd like to refer to three cases from my research: international adoption, international surrogacy, and domestic surrogacy. And I'll refer to this third case only briefly. I'd like to look at them through the lens of two reproductive justice questions: on the rights of birth mothers and families, and on reproducing class and race. And I'd also like to point out that these three cases exist alongside other kinds of queer reproductive migrations. For example, migrations of gametes, such as shipping donor sperm from Denmark by lesbian women in the UK. Rika Andreasen wrote about it, interestingly. Or migrations and travels by LGBTQ people who already have children, where in some jurisdictions they are recognized as parents, whereas in others they are not. And finally, there are also migrations by reproductive workers who help LGBTQ and other intended parents. Christina Weiss, in her recent ethnography, showed how some women from different parts of Russia migrate to St. Petersburg in order to become surrogacy workers. So feminist studies of reproduction show how medical migrations, to use Caris Thompson's term, often follow colonial routes, and they may reinforce inequalities. On the other hand, those people who travel in order to have children often do it because they think they can't become parents in the places where they live. They become reproductive exiles, in Marcia Inghorn's words. Some dilemmas about such reproductive travels could perhaps be solved by applying the framework of reproductive justice to those queer reproductive migrations. Reproductive justice is understood as rights to bodily autonomy, to have children, not to have children, and to raise them in safe and sustainable communities. It also emphasizes the need for support for communities that have been excluded due to race and class politics. So in this spirit, in a symposium at UC Berkeley in 2016, with Caris Thompson and Wyndham Twine, we asked how queer kinships and reproductive justice could be read together, and how queer people could reproduce without reproducing inequalities. So in the special issue of Reproductive Biomedicine and Society in 2018, we argued for support for all LGBTQ people's parenting aspirations and reproductive rights, and at the same time, support for reproductive and other rights, including basic rights to healthcare for egg donors and providers, surrogate mothers, birth families in adoption. So we argued for broad solidarities. How do those arguments play out in the cases from the field? So case one, adoption trouble. In my PhD research in Spain in 2011, I sought to speak to families with gay fathers. In one of the biggest rainbow family associations in Catalonia, Familias de Lesbianas y Gays, among the gay fathers, only a few resorted to international surrogacy, whereas most had children through adoption. Given there were few children available to adopt in Spain, they created their families mainly through international adoption from Eastern Europe, East Asia, South America, and Africa. I first undertook an ethnographic study with 12 Spanish families created through international adoption. And here in this photo, you can see some of the children when they were watching movies and playing together during one of the Saturday night meetings of my befriended group of gay fathers in the area of Barcelona. During the family picnics, weekend meetings in the family homes, official association gatherings, and other outings where the families of gay fathers used to meet, I often heard them exchange the global news and updates about gay adoption, such as Russia had closed to gay couples but not to single men, or Haiti had opened to single men, and similar updates were common. I soon realized that even if the recent 2005 law of gay marriage in Spain had given queer people the right to have and raise children together, through adoption for lesbian and gay couples and through IVF for lesbian women, it was not that easy for them to get to have children at all. They went into great lengths to figure out where and how they could become parents. Their pursuits often led them to creating interracial families and to developing what Wyndham Twine termed interracial literacy. That is, anti-racist projects that include cultivating multiracial heritage as well as a capacity to recognize and counter racialized structures. A few of my interviewees adopted as officially single men in foreign countries that didn't allow adoption for gay people, and only later in Spain did they pursue the so-called second parent adoption by their partners. The men I interviewed talked with commotion about their trips to Ethiopia, Russia, Haiti, China, and other places in order to pick up the children. On those trips, some of the men were accompanied by their female friends in order to appear as heterosexual couples. Only upon return home did they openly act as gay parents with children, raising awareness about family diversity in their children's schools, local communities, and extended families. From this relatively safe position, they sent their children to classes of Russian, Chinese, and their other languages of origin, and they planned family journeys to the children's countries of birth. This was a complex performance. These families of gay men created through international adoption were mostly interracial, or as they called themselves, multi-ethnic. Therefore, they linked LGBTQ politics very clearly to anti-racist politics. For example, at some point I was invited to give a talk about my research by an association of adoptive parents, both queer and heterosexual, called Association of Multi-Ethnic Adoptive Families in Granada, in the southern region of Andalusia. The adoptive parents I met worked hard to tackle both racism and homophobia at the same time. They organized and regularly shared on the association's Facebook talks such as, "Are you ready to help your children face discrimination and racism?" So here you can see 3 promotional photos of such workshops. Some of the families I met throughout my research, even if only very few, undertook pioneering work in order to establish contacts and relationships with their adopted children's birth families. Dr. Aranzazu Gallego from the University of Granada joined a small group of Spanish adoptive families in their search for their children's origins in Ethiopia and in their joint work with the birth families. It soon turned out that the birth families in Ethiopia, as well as the Ethiopian children adopted in Spain, were just happy to know about each other, to be in touch, to visit each other, and in this way sustain a kind of what we could perhaps call queer kinship. However, most of the gay father families I spoke to didn't go as far as to meet their adopted children's birth families. From the interviews with the gay fathers I met, it was clear to me that they were already concerned enough with being marginalized as gay parents, as they viewed their own parenting rights as fragile and only recently won. Yet one thing prevailed across most of the families I spoke to. In their daily lives, they joined their LGBTQ politics with anti-racist politics, and they were all trained in what Wyndham Twine called interracial literacy. In terms of class, the gay men I spoke to represented relatively diverse backgrounds, even if only a minority of them described themselves as working class and most placed themselves in the middle class. Despite a few to several €1,000 of fees, it was possible for them to access international adoption. So these questions could, in some cases, be even more complex in international surrogacy, which is case 2. So in my postdoc study in the United States, I followed 20 families of gay men, or 37 individuals, as they pursued compensated surrogacy in California and Oregon. Half of them, 10 families, lived in the US and so pursued domestic surrogacy, even if often between different states within the US. And the other 10 families were Europeans who lived across the Atlantic and traveled to the US for international surrogacy. In 2015, I traveled from my then home in San Francisco to Brussels in Belgium, where the New York-based organization Men Having Babies held their surrogacy conference and expo called Parenting Options for European Gay Men. The event attracted over 200 gay men, whom you can see in the photo, mostly from Belgium, the Netherlands, and France, who are looking to become parents through international surrogacy in the United States and Canada. So it was there in Brussels that I first met Jelle and Tony. Tony was 45 years old and Jelle was 35 at that time. The guys had been together for some 7 years. They had 2.5-year-old twins through surrogacy in the US, and they lived in a large city in their native Netherlands. And actually, when I met them for the first time at the Men Having Babies conference, they were together with Nancy, the surrogate, the term she herself used to talk about her relationship to Jelle and Tony's family. Nancy also flew from the United States to Belgium to take part in the Brussels conference. I came up to a conference exhibition stand where Jelle was promoting a Dutch Association of Rainbow Families and Nancy was showcasing international surrogacy in the US. Jelle's husband, Tony, was playing with a bunch of kids who included both Jelle and Tony's children born with the help of Nancy, and Nancy and her husband's children who traveled with her to Brussels as well. Why the US? I asked Jelle and Tony. Tony said, you pay much more in the United States, but after all, everything is settled in the right way. We also had very strict feelings about what we're going to tell the kids in the future. And the US felt really, really comfortable. We're going to go to a country that we're able to communicate well in, and we happen to love the US. So we also went for holiday a couple of times there. So it all came together, and the fact that, well, it felt right. So the perception of the USA as the only reliable destination for surrogacy was common among my interviewees for a series of practical reasons. Yet the United States were also discussed as something more than just the practical in the men's narratives. Presenting the US as a land of freedoms, including reproductive freedoms for gay people, was a narrative as understandable in the context of these gay men's marginalization stories as it was problematic, given the structural inequalities in the context of which the US fertility industry and reproductive politics have been shaped. The men I interviewed had to contend with inequalities as well. Social class mediated their access to parenthood due to the very high costs of international surrogacy. Also, the politics of race were visible through the surrogacy arrangements. The vast majority of the men I interviewed in the 3 locations they came from, the USA, the European Union states, and later also the UK, matched the skin color of egg donors to their own, regardless of the racial or ethnic status they identified with. So Diego says, we chose an egg donor who would resemble the Spanish type of woman and not someone with certain physical characteristics that are not common in our family. I think by the fact of having 2 fathers and the fact of having been born through surrogacy, he, that is the son, is already different enough from his peers. Contrary to most of the families created through international adoption I discussed earlier, the fathers through surrogacy thought that visible differences between their children and themselves could jeopardize the social perceptions of their kinship ties, which were already under scrutiny due to the father's sexuality. Secondly, many of them preferred their children not to look too different than the social majority. As a result, in most of the surrogacy families, anti-racist education didn't come up as an obvious issue. To me, it showed that formulating intersectional and anti-racist politics was simply somehow less obvious in most surrogacy travels, contrary to most adoptive travels that I encountered in my research. This could have played out differently, even if not in less problematic ways, if those surrogacy travels of Spanish gay men had been to India or Mexico rather than the USA, or if the adoption travels had been only to Eastern Europe rather than to Africa and Asia. All in all, in international surrogacy in the USA, it was possible to at least approach reproductive justice questions through maintaining contacts with surrogate mothers and less often egg donors. The impact of social class seemed more obvious than in adoption, as access to surrogacy required the expense of $80,000 to $150,000 US per arrangement. So I asked myself, could this be countered if it was legal to carry out surrogacy in Spain? Just like the existence of altruistic surrogacy in the UK makes it possible for some British people to do it at home. In the cases of international surrogacy I encountered in my research, the politics of race were problematized much less than in adoption. So I've been left with a question: how formulating an intersectional approach, including interracial literacy, could be possible in international surrogacy? So these questions seem to be even more relevant, as in some jurisdictions, international surrogacy can be one of the very few ways for gay men to have children. For example, in Italy, where gay couples and single people are not allowed to adopt nationally or internationally, nor to pursue domestic surrogacy. Recently, I wrote this blog post on this issue, which is available on ReproSoc's blog site. Before I conclude, let me just briefly point to one more kind of queer reproductive migration, that which happens when gay people migrate and settle in a country where they could potentially have children. The UK could be such a case, being the only jurisdiction in Europe with a developed and legal altruistic surrogacy model. So over the past few months, I've carried out 22 online interviews on Zoom and Skype with gay men who live in the UK and have pursued surrogacy, mostly the altruistic surrogacy in the UK. I've also heard stories of a few British gay men who have traveled overseas for surrogacy in the US and Canada for a series of reasons, such as their HIV positive status, long waiting times in the UK, social and cultural skills required for networking in surrogacy socials and meetups in the UK, and the fact that parental orders are granted only after the child's birth in UK surrogacy. For example, Alex and Matteo have lived in London long enough to become British citizens. Alex came from a European country and Matteo from South America. They're both in their early 40s. Alex works in translation and interpreting, and Matteo is a self-employed physiotherapist. They've been together for 6 years. In 2020, they just had twins through surrogacy in Canada. So Alex says, we're both HIV positive, and when we researched surrogacy in the UK for a good year, and we then eventually hit a brick wall, because I don't know if you're aware of it, but the human embryology and fertility legislation actually prohibits HIV-positive intended parents to do surrogacy in the UK. So that was, quite heartbreaking. Whereas in Canada, everything is very different. In terms of regulation, perception, people are so much more relaxed about HIV. So there was no issue finding an agency, a clinic, and a surrogate. However, the vast majority of my interviewees were able to pursue surrogacy in the UK. They preferred the friendship ethos on which it is based, and it was also cheaper to do it here for between £15,000 and £60,000, depending on the arrangement. Yet, what drew my attention was that among the 22 gay men's families in the UK I spoke to, there were 16 different identifications in terms of national belonging. You can see them in this table marked in blue: Spanish, Polish, South African, Welsh, Italian, German, Brazilian, Catalan, Filipino, South Asian, US American, Australian, Israeli, New Zealander. So this is the men's own identifications that they use while they were living in the UK, even if only 4 of my interviewees were non-white. So this made me think that some reproductive migrations might also involve not only short-term travel, but actually settling in a place where new options for creating a family open up. So in this talk, I've been trying to show how the gay men I interviewed undertook international travel for adoption or surrogacy. In this process, they would often become, to use Marcia Inhorn's term, reproductive exiles from the countries they lived in. Yet at the same time, some of them might also have got involved in reproducing inequalities that reproductive justice activists and scholars have long been pointing to. The rights of birth families and adoption, the rights of surrogate mothers and their donors, reproducing some racialized or class structures of privilege. Here I've attempted to show how some of the men I spoke to tried to think not only about queer kinship, but also about reproductive justice issues. For example, through incorporating anti-racist education projects in their LGBTQ associations, or by maintaining contacts with birth families or surrogate mothers. Even if not all of them succeeded, and even if not all of them even got to think about it. Thank you. So I will leave it here.
Thanks, Marcin, very much. That was great. If you've got any questions for Marcin, please feel free to put them in the chat and we'll collect them all at the end. But we'll now move on to our second speaker, Arthur Davis, who recently completed their MPhil research on the sexual well-being of mobile populations at the University of Cambridge's Centre for Gender Studies. In their work, they look at how the conceptual contours of the sexual migrant, in inverted commas, contribute to the exoticization and stigmatization of certain sexually active migrants, while rendering others other potentially at-risk individuals invisible, and thus beyond the bounds of targeted sexual health interventions. Arthur is currently applying for PhD programs in which they plan to further their current work through patient observation and interviews with service users. So if anybody has any ideas of where they can find opportunities, then do let them know afterwards. And Arthur's talk is entitled Temporalities and Tension, Rethinking the Sexual Migrant in Epidemiological Research and Clinical Practice. That's a hard word for a Friday afternoon. Arthur.
Yeah, let's see how many times I trip up on epidemiological as well. Now I've got to start sharing my screen, which is easier said than done. There we are. Fantastic. So good evening. I want to say a big thank you to all of you who've taken the time to attend today. I feel really honored to be discussing my work in such esteemed company and to be following such a fantastic presentation, Marcin. I'm going to start by giving a little bit of context for my work, and then I will get into the nitty-gritty a bit more after that. So there is something I think inherently migratory, as the name of this conference suggests, about queer experiences and subjectivities. If we understand movement to be temporal as well as spatial, then we're able to grant migrant status to people who cross temporal as well as spatial borders. Queer migrations happen not only against a spatial backdrop, homeland to promised land, but also against countless temporal ones, heteronormativity to queerdom, chronological time to cyclical time, in the closet to out of it. And these aren't migrations that happen once only. Temporal migrations back and forth between the demands of incompatible worlds can happen on a daily basis. So my work isn't just a theoretical interjection about better ways of conceptualizing queer journeys. Using sexual healthcare settings as a specific location from which to make sense of queer migrations, my work seeks to make a serious contribution to epidemiological research and clinical practice. As Geoffrey highlighted at the beginning of this talk, I argue in that work that a failure to properly define the migrant, thanks for the round of applause, Geoffrey, and the sexual health risks associated with the migrant, that risks contributing to the stigmatization and exclusion of certain foreign-seeming migrants while rendering other migrants invisible and thus outside the reach of targeted sexual healthcare interventions. There's a significant literature seeking to identify appropriate sexual health interventions for migrant populations, many of whom are also understood to be queer, though often the two things are treated as indissociable, as dissociable, which is something that I sort of challenge a bit in my work. Specifically, I deal with, in my work, a subsection of epidemiological literature on so-called sexual migrants. But before addressing these epidemiological texts, I think it's important to briefly trace out the history of the sexual migrant as category of analysis. The notion of the sexual migrant is something we see cropping up in urban geography and sociology texts from the early 1980s onwards. And this literature essentially recognizes that gender or sexual orientation can be the primary pull or push factors behind migration. These texts, however, have a tendency to emphasize the all too familiar journeys from backward rurality to progressive urban spaces at the expense of many queer existences that flourish outside of urban sex zones. Now, in terms of epidemiological interaction with the concept of the sexual migrant, we see several key questions being asked. Who, that is, which migrant groups are at risk of sexually transmitted infections? When is the risk greatest? Where is it happening and why? But of the 5 W's, it's the what which is the notable exception from this work. Very little attention has been paid to the question of what exactly the migrant or migration is. Which border crossings make a migrant? Is migration necessarily a spatial phenomenon? Failure to pay proper attention to this consideration seriously hampers the content validity of research into the sexual health outcomes of migrant populations. How can we be sure that we're measuring what we claim to be measuring if we haven't put the time into properly defining its conceptual contours? So let's take a closer look at the epidemiological literature involved in order to make things a little bit clearer. So in my research, I've paid specific attention to a particularly extensive literature on the sexual well-being of migrants from Central and Eastern Europe. What is the story that's being told by this literature? And I use the word story because epidemiology, as Priscilla Wald reminds us, is all about telling a convincing story of disease transmission. As such, the narratives are just as important as the numbers. The story in terms of sexual risk in Central and Eastern European migrant populations is as follows. It has 3 key parts. Firstly, Western European, but particularly British cities, or at least they were at the time of writing, are hubs for LGBTQ+ migrants. And that's due to perceived opportunities for freer expression of their gender and/or sexual identity in those places. Secondly, Britain has the highest number of new diagnoses of sexually transmitted HIV in Europe, meaning sexually active migrants to these places face heightened sexual risk. Thirdly, knowledge of safer sex and adherence to safer sexual behaviours tend to be lower in countries with high levels of institutionalized homophobia and transphobia, which means that people from places with high levels of homophobia and transphobia logically would face heightened risk upon arrival to places where STIs were more prevalent. Correctly identifying the sexual health needs of these individuals is thus of paramount importance. The epidemiological literature on sexual migrants is broadly split into 2 sections, quantitative and qualitative, and I'll address both in turn. The quantitative literature shows us things like the statistics that you see on the screen now. 28.3% of a sample of Central and Eastern European men who have sex with men who migrated to London engaged in unprotected anal intercourse, UAI, within a year of arrival. They were more likely to have taken recreational drugs, to have been paid for sex, and to have slept with partners not from their home country. They had a higher turnover, quote unquote, of partners than heterosexual immigrants, and were more likely to contract STIs than they were in their home countries. There are, of course, several weaknesses to the methodologies employed by these studies. Firstly, they rely on self-reporting rather than biological samples. They also relied on self-identifying as LGBTQ+, but we know that many MSM, men who have sex with men, consider themselves to be straight. And what's more, and I'll come on to this a bit more later in the talk, it's those individuals in particular who find themselves at heightened sexual risk due to the abrupt temporal boundary crossings that they make. Thirdly, migrants from broad geographical areas in these quantitative studies, such as Central and Eastern Europe, are aggregated, thereby ignoring the nuances of different factors influencing migrant MSM from each individual country. Most importantly, however, these studies, while revealing general patterns, fail to address why migrant MSM engage in risky behaviours. That is, what are the specific dynamics at play and the lived experiences that are involved? Qualitative research is better placed to tell us that. According to this work, Central and Eastern European migrant risk perceptions are skewed due to a lack of sexual health knowledge. Thus, Richard Mole argues, as well as Nicola Mai and several others, that risk perceptions of migrant populations, spatially construed, are often informed less by sexual behavior and condom use and more by performed characteristics of their sexual partners. These characteristics include physical health and cleanliness, but also race, ethnic origin, masculinity, and sexual role. So this qualitative research goes a little further in explaining the dynamics at play when it comes to sexual risk in migrant populations, but there are still many methodological limitations. There's a failure to problematize nationality or even region as the appropriate category of analysis. And there's little effort to take other factors like socioeconomic status into account. As we know, there is a far more checkered reality of sexual risk behaviors that transcends national borders. Indeed, if Britain is the European capital of sexually transmitted HIV, how can we portray sexual risk as a foreign problem? The constant migratory fluxes that have, up until now at least, been part and parcel of life in 21st century Europe mean that no migration is ever done and dusted. And so, we're constantly migrating. And I think it's important to say constantly migrating not only from here to there, but also from here to there, which is what's really important when thinking about queer migrations. It's really important to have a proper think about how we can bottle that understanding and apply it to epidemiological research. And I think that's a task that's of both theoretical and practical importance, which is why I'm undertaking it. So a number of public health research studies have sought to avoid framing sexual risk as a foreign problem. Several researchers have looked at the experiences of rural to urban migrants, which often seem to mirror the experiences of international migrants. Surprise, surprise. Gillibrand and Turner, much like Richard Mole and Nicola Mai in their studies of Central and Eastern European men who have sex with men, find that sexual migrants from rural areas are likely to associate sexual risk with factors such as physical health, cleanliness, and masculinity. Sounds familiar. Wu et al.'s study of HIV transmission in Chinese cities highlights that rural to urban migration is a better predictor of sexual risk than international border crossings alone. Bianchi and also Egan find that anonymity, lack of social networks, and perceived loss of close family relationships are key factors increasing the sexual risk faced by new migrants in urban centres. Meanwhile, Richard Mole highlights that regional disparities in sexual risk behaviours across the UK have much to do with unequal access to high quality sexual health education in schools. And it almost goes without saying, factors such as class, race, and gender have a huge impact in the sexual health outcomes of subnational and international migrants alike. A tempting way initially to reconceptualize the migrant then is in terms of the sexual core and sexual periphery. That is, a topography that's divorced from purely spatial considerations. According to such a topography, a homophobic, or I could say sex-negative environment in a place like Brighton, for example, would be considered sexually peripheral, while a queer or sex-positive environment in, say, Budapest would be considered part of the sexual core. This topology may help us to break free from territorial shackles, but it nonetheless reinstates a binary which is not only exclusionary, but also an inaccurate reflection of the complex, constant, and multi-directional migrations to which we're all subjected. Instead, I argue for a framework that takes temporal migration into account. The first step of this is to do the proper conceptual groundwork in defining temporal migration and familiarizing epidemiologists with this new dimension to the phenomenon that we call commonly migration. Jack Halberstam, in his work In a Queer Time and Place, has gone a long way in helping us think through the notion of temporal migration, albeit in a non-clinical context. He emphasizes that time is not something singular, but rather that reproductive temporality, that is logic's of social and sexual organization centering on heterosexist institutions of birth, marriage, reproduction, and death stand in opposition to so-called queer timelines. The next step then is to understand what bearing these timelines have on sexual risk. In my research, I argue that it's not the timelines in themselves, but rather abrupt border crossings between them that contribute to heightened sexual risk. With the help of interviews with sexual health practitioners, I identify at least 2 levels on which abrupt temporal shifts contribute to heightened sexual risk. Firstly, there's the extraclinical level, what happens outside the clinic. And here we're particularly thinking about sexual encounters. Secondly, there's what happens in the clinic. I'll address both aspects in turn with the help of testimonies from practitioners I interviewed as part of my MPhil studies here in Cambridge. This first quotation is taken from an interview I conducted with a consultant working in a sexual health clinic in the UK. This practitioner was talking about diaspora groups they were working with and the strict heteronorms emanating from within the particular community they were talking about. I'll give you a second to read that quote. And we see with this example that it is the abruptness of the shift from a family timeline to a queer timeline that contributes especially to sexual risk. These 2 dichotomized versions of the self and having to quickly negotiate that transition between the 2 in the absence of the proper knowledge and practices which are going to help you negotiate that safely. So this comes in the form of an inability to negotiate condom use due to a lack of safe sex knowledge and or intoxication due to sexualized drug use. This quotation here is from a nurse practitioner in another British sexual health clinic who was speaking about outreach work that they do in a local gay sauna. And again, I'll give you a second to read that. It's a bit of a longer quote. And again, with this, we see that for this practitioner, abrupt temporal shifts in the absence of sexual health guidance can significantly heighten sexual risk. Those sort of abrupt shifts between the boxes of family man and man who has sex with men in the gay sauna. And as well as during sexual encounters, temporalities were also at play inside sexual health clinics. This is a final quote that I'll show you from a consultant I interviewed, also working in a UK sexual health clinic. And I think we see quite clearly with this quote how the incompatibility between institutional temporalities and those of service users will lower the uptake of sexual health services by certain groups with obvious consequences. So I think several implications follow from the recognition of the temporal dynamics of sexual risk. From a theoretical perspective, it's necessary to better define the temporal migrant and normalize the application of this category to epidemiological and clinical work. This includes a more holistic identification of risk factors and clinical need when studying migrant health and when dealing with patients. I think a personal anecdote is quite useful here to clarify why I think there's such a need for this in clinical settings, which is it was around, I'd say about 10 months after I moved from my hometown to the big city, as I saw it at that point in time. And I found myself in a sexual health clinic undergoing a sort of routine checkup. And so while taking my sexual history, the doctor asked, have you had sex with anyone from Africa in the last 3 months? Upon reflection, my answer was yes. Although my answer nowadays is always, I never thought to ask. Upon further reflection, I realized that during the encounter in question, it was my partner, not me, who insisted on taking all the necessary precautions in that case. Indeed, during the previous months, I'd been negotiating a whole new world of apps, sex clubs, chemsex and the like, without any of the necessary sexual health guidance. Now, my appearance as a white British middle-class male-presenting individual in this sexual health clinic didn't seem to ring any institutional alarm bells. There were no categories to conceptualize the risk posed by my migration, whereas the risk posed by my African sexual partner was clearly emphasized, and there were categories clearly in place. Their migratory risk was highlighted while mine was elided altogether. The violence posed by such categorizations goes without saying, and risks perpetuating a significantly skewed focus in clinical settings and research. Targeted risk reduction interventions would do well to take into account the temporal as well as the spatial shifts undergone by service users. As well as better understanding the temporal shifts that take place outside the sexual health clinic, it's important to recognize the temporalities at play within spaces of sexual healthcare provision. As practitioner testimonies have shown, the branding of sexual health services should take account of the invisible temporal barriers faced by users. Straight identifying men who have sex with men, for example, are unlikely to feel comfortable in spaces branded for gay and bisexual patients or in family planning clinics. Likewise, service users may be unlikely to feel comfortable in spaces dominated by reproductive temporality. This reduced accessibility to key services contributes, of course, to lower diagnosis rates and heightened sexual risk. I hope to have made a strong case for the existence of temporal migration and its applicability to sexual health provision. What is more, I hope to have shown that endpoints are no more important than the journeys that lead us to them. Each border crossing reveals new boundaries yet to be transgressed. So too will our future research in this area reveal entirely new discoveries. It's up to us all, of course, to rise to the challenge. Thank you for listening.
Thanks very much, Arthur. That was great. So we've got quite a bit of time now for some questions. I don't see any in the chat at the minute, so do feel free to turn your cameras on and raise your hand if you have any. I'm going to start with a question for Marcin, if I might. Still here? Yes, you are. So I was really taken by that. I really like this idea of the intersectional approach that you were taking to issues of social class, race in terms of surrogacy and adoption. And as you were talking about it, I kept thinking back to Fadi Salah's paper on Tuesday about the legal fallacy and how a purely kind of legal overview of all of these really difficult and complex social processes, the law itself and a legal framework are completely incompatible, if you like, or incapable of dealing with those complexities. And you also said that at some point, some of the participants that you talked to, they would take trips elsewhere and take a female, take a woman with them in order to perform a type of heterosexuality, heteronormativity. And I just wondered how the participants themselves reflect on that, on their necessity to do that and to kind of jump through hurdles which are not legal, but in order to perform a legal process.
Yeah, thanks. It's a very good question because there's a lot of tension in this respect in the people's narratives. On one hand, they do recognize that there is some importance of the legal regulations within which they move, and that they are subject somehow to those regulations. And on the other hand, they do want to somehow circumvent those regulations, and those examples that you've also mentioned that I gave. So there is a tension, and I guess the most important thing here is that they remember and they mention quite a lot the histories of marginalization, that they could not be recognized as a family, for example, right? That for some reason their rights could be taken away, that it's all very new, that it's all very fragile, that it's all very uncertain. So that's why they, on one hand, are activists in those communities or those spaces where they feel sufficiently empowered, like, for example, neighborhoods or children's schools, But on the other hand, there are other spaces where they feel that they have to take extra precautions. So they kind of constantly work around those legal regulations and social norms that they encounter. I'm not sure if that answers your question, but there is this ambivalence about the legal, right? Because it obviously does have an impact on their lives, right? On the other, there are ways to go about it.
Thanks. Any other questions? Anybody want to turn their cameras on and ask a question? Leila?
Thank you, and thanks both for such interesting papers. Again, so different from the previous days, but such interesting red threads. Do we say that? Yeah, threads. Maybe we just say threads in English. Yeah, my question is to Arthur. I was really interested in what you were talking about when you were saying you were talking about migration from rural to urban areas, and you were talking about a kind of abruptness, and it sounded like you were describing kind of codes that needed to be read, and maybe talking about sort of reading time into that or onto that. And I was just wondering if you could say a bit more about how this abruptness fits with your analysis via Halberstam.
Right, thank you. Yes, I'll try my best to answer that as well as I can. What I loved when I was reading Halberstam for the first time, far too late in my life, was this recognition that the world doesn't make sense in the same way to the same people. Of course, there are lots of other authors that focus on that through work on temporality and the interaction between time and space. The notion of the kind of chronotype, you know, how do these two things come together in unique constellations? That seemed for me to resonate a lot with, and of course personal experience will always be a key kind of thing that drives us towards academic questions, of the experiences that I had and that other people have described to me of moving from a world dominated by one set of demands to another. And that takes on lots of different appearances. You know, if I think about sexual encounters, you're absolutely right to point out the differing codes that seem to go along with different worlds that we inhabit. And, you know, of course, I am thinking and need to try as much as possible to distance myself from my experience on this. But of course, naturally, I think about those sort of jarring things of, you know, being maybe living in a big city for a long time and never having had a sexual relationship with someone outside of that, and then going back to, you know, that hometown and suddenly realizing, oh, this is different. And of course, the way that those experiences differ are going to have sexual health implications. What's more, I think they tell us something fundamental about migration, about movement, which is that you can't understand it outside of the ways in which you're interacting with it. Does that make sense?
Okay, we have a question from Amar, who says that that they wanted to ask Marcin if they could say a little bit more on the challenges of finding participants, the trust that's needed to build connections within the community, and the ethical issues related to interviewing people on such personal matters. Thanks for the question.
Thank you very much for this question. I think it might be interesting for all of us who've been research in some ways. And in this case, I guess, like in many other cases, it of course takes time and it takes a commitment. It's a tricky thing because on one hand, I found myself sometimes speaking to people and hearing things which were somehow surprising, or which were somehow, you know, with which I wouldn't agree with the kind of queer feminist background from which I was coming. But at the same time, I wanted to be respectful towards my interviewees, and I wanted to, really do justice to their very complex situation. So I think I negotiated it in a way which was, on one hand, being very respectful and being declaring directly to my interviewees that I would, also identified as gay or queer myself, and that I was, which wasn't necessary, but I think as I do identify this way, I think it was fine, and that I kind of wanted to give back to the community in some way, to the community and to all involved, right? I exchanged a lot of information. I was in constant interaction with my interviewees, getting their authorizations for some things that I was publishing or talking about publicly, and so I was trying to negotiate it in this way. And then I do remember, for instance, once I was invited by Men Having Babies to speak at a conference. One of them was that conference in Brussels that I showed the pictures from, and another one in San Francisco and in New York. And I do remember speaking to my mentor, Caris Thompson, at the time, and asking, like, Caris, what should I do? Because of course it's a very tricky situation. I'm speaking in front of those interviewees, but I do have some critiques of what they're doing, and I've given a lot of thought into it, and I think. What I've been always trying to do was, on one hand, just being in a very open conversation with them and telling my interviewees, okay, look, this is what the feminist scholarship is saying. This is what reproductive justice is saying. How do we apply this? Do you agree with it? Kind of sometimes being even slightly pedagogical in inverted commas, and sometimes, just shifting completely and always being very respectful of what they are saying. And the last thing to say is of course over time it's getting better and better because we all learn. I remember some of the first interviews, it was very difficult. It's always very difficult to get into the field, to get to know people, and then as you go and you try to keep some kind of integrity, then I think people slowly started to appreciate this relationship, and somehow in a way I've become a kind of a friend of the community, but always in my role of the academic who's slightly, on the outside or margin, and kind of keeping conversation with them. So I've been working on it all the time, and of course it takes time. Yeah, it takes time, as you say, because gaining trust and getting to know people, sometimes it's months and months of networking, of emails, of meetings, of meeting people. So yeah, it's a very good question. Yeah.
It's interesting that you ended that answer by talking about the kind of the balance between the personal and the academic. And one of the things you started the talk with was the idea that medical migrations follow colonial routes, which does seem a kind of very academic thing to say. But then when you think about it, I mean, I think it's really interesting if you could say a little bit about how your participants thought about that. I mean, if you brought that up in conversations with them, or if they themselves reflected on that in any way.
Yeah, absolutely. I always tried to bring it up, and I tried to reflect together on it, and I had to learn it as well, because I remember some of the first interviews, for example, I was scared about asking them about race. I was like speaking to them, and I had this question on my list about the choice of the egg donors and about the choice of the destinations if they went to India or Mexico or the US, and how if they matched their skin color to the egg donor's skin color, and I was scared about asking it. I didn't know how to ask, but slowly over time I somehow got relaxed in it, and I just learned that it's fine just to ask, so simply like, how did you go about it? What did you think? Did you take into account some literature or some news about what might be happening on the other side, right? What do you know about your surrogate mothers? Do you know about the donors? Do you know about the birth families? So I've just been trying to have this conversation, but of course some people didn't talk about it too much. And it came especially, for example, we're talking about the skin color, I think, because talking about roots and colonial roots and post-colonial roots, it was somehow more obvious because people were quite explicit, like, oh, we went to the USA because, or we went to India because. you know, and they had their narrative about it and their understanding of it. Speaking about the skin color was a bit more tricky, especially because most of my interviews were white, and and I think there is this kind of invisibility of whiteness, right? So sometimes they were just surprised by my questions. Sometimes they had reflected on it, but as I said, that interracial literacy was something that mainly those interviewers who were already in mixed race families had, right? So it's been a learning curve.
Okay, great. We have a question for both of you from Nicholas, and he asks, what intersections you both see between studies of queer sexual or reproductive migration and research into sex work and migration? For example, work by Mai, who Arthur cited, or work by Agustin. Obviously, there are important overlaps, but I often see these discussed separately when it comes to policy, law, and research.
It's a good question. I think it's a hard question to answer. My mind is drawn in two directions immediately, but I would welcome interjections from anyone else who has had a bit more time to consider these kinds of things. The aspect of legality is a kind of key aspect here, and it's an aspect which I touch on tangentially in my work. Obviously, there are lots of legal considerations to work in a sexual health clinic. Things like, you know, anonymity, best practice, and so. But it's a very different kind of world, isn't it, to kind of the world of sex work, which doesn't necessarily have legal recognition depending on where you are. The other thing that comes to mind is about categorizations and how we group people in like this. Okay, so how are we going to bring together sexual and reproductive migration with research into sort of sex work and whatever? Well, who's to say they're not already kind of integrated within one another, that the people who occupy, the people who we're looking at in these kinds of things aren't already quite well kind of integrated, and that those issues don't sort of touch across multiple different boundaries. But yeah, I feel it's a really good question, and I'd be curious to know a little bit more about what prompted it and what the person asking it sort of thinks. Maybe they have some ideas on that.
Nicholas, feel free to interject if you'd like.
Precisely, Arthur, what you were saying about, you know, that the overlapping populations, overlapping policies, overlapping research, and I think it's precisely the issue of legality that creates a kind of false division among the categories. So yeah, I really appreciate your answer.
Marcin, would you like to add anything to that question?
It's a very interesting question. I actually, right this week, I've been teaching a class of Sociology of Health and Illness on sexual and reproductive health. And I also, in the readings that I was going through, I also note, on one hand, I saw the informal definitions such as the United Nations, right? For example, it goes together, sexual and reproductive health. But then when you go to research, you actually see, as you say, precisely, it's separate. Right? It's separate. But probably we need to find those links because they are there, but they are quite hidden. And I think one of the quite obvious links is the one of HIV and reproduction that we've mentioned. Robert Pralat here in Reprosoc has also been working on it, on what he's called sexual and reproductive health together, right? And it's also come up in my research, but it's been just 2 or 3 interviews, right? And probably it is somehow there, but my own interviews have separated it somehow. You know, in many narratives, they would say like, oh, you know, we had all this queer sex life, and we had, you know, and we used to go to clinics, and you know, and but now we're over. We're at a different stage. You know, now we're going to have children, right? So they themselves kind of separated it, but of course, it's a narrative move as well, and for sure there are intersections, but it's actually a good inspiration for me to think about how to ask about it and how to look for it, because I'm sure that it does overlap and intersect, but it's quite hidden. Yeah.
Thanks. Next is Michael. I'll give you a couple of seconds if you'd like to ask your question yourself.
My question was for Arthur. Apologies for arriving late into the presentation, Arthur. So I apologize if it wasn't your target group of people that you were researching, but I did wonder if you've got any sense of how, I mean, temporality is highly gendered, and just like space is highly gendered and mobility. So I'm wondering if you had a sense of how gender plays out in terms of the really interesting link you made between a kind of queer temporality and sexual health.
So I'd say I'm interested in every group. Obviously, a lot of what I read was to do with particularly men who have sex with men, but I'm very interested in the kind of flows of becoming and unbecoming that kind of blur those boundaries between different groups. And I think what is interesting then when you take something like gender or perhaps even sex, is that what we see is, regardless of gender identity, people continue to be marked out in ways which they can't avoid based on the way they appear. And that's not just about gendered appearance, it's also racialized, lots of factors at play. So I think I have to recognize in the work that I'm doing that a lot of what I'm looking at is, it plays on those kind of subtler, softer dynamics which can be pretty much bulldozed by first impressions, and perhaps the ability of someone to speak or to even get to a point of having these kinds of negotiations in the first place depends on how they present, and whether they're granted, whether that privilege of or that right to speak for themselves and define themselves in sexual situations. I think it's a shortcoming of the work that I've done so far, and I'd be very receptive to thoughts about how to kind of integrate that as much as possible while kind of retaining that focus on, as much as possible, moving away from strict groupings, but of course acknowledging that it's not realistic in the world that we live in. And maybe I can elaborate on some aspects of that if you don't feel like I've addressed something that you're particularly interested in.
No, it was around the fact, migration experiences if it's, for example, coming to the UK, or and even the reasons people migrate, the types of employment or jobs or lives they come into, there are quite big differences around gender, and I thought that would absolutely affect then this temporality that you were talking about, and then sexual health, whether it's framed as risk, pleasure, choice, more involuntary. I thought all those dynamics, like when you presented the little vignette about the queer man who was isolated and then went to sex parties, I was really thinking, okay, well, how would this play out with kind of cis women or transgender? I was like, because that complexity would have a kind of gendered element. But sorry, I'm hogging the conversation. But
no, it's a really good point, and something that deserves more attention. Yeah, it's actually I'm really glad that you raised it, and I unfortunately I don't think I can offer anything else at this point, but we can continue this conversation if you'd be interested in that.
Yeah,
cool.
Great. We've got lots of comments saying how fascinating and wonderful the presentations were, so it's worth reading those out. And then we'll move on to a question from Michelle.
Hello. I think my question might loosely link to what Michael was just saying. I've got a question about how maybe with your study, taking it forward, thinking about linking philosophy into that. What I'm particularly thinking of is there's a lot of clinical and quantitative stuff happening, but things like the philosophy around phenomenology, for example, like Carl Rogers and Herschel Edmund, which is about clarifying how people experience and comprehend their phenomena. So this temporal migration, getting a better definition from lots of different people, their own experience, to better define what this temporal migration is, the subjective of all those different groups. Now, I know how would you get a wide qualitative? That's kind of an issue in itself, and it will take a lot of work. Do you think that would matter and inform better practice, though?
Your question, as I understand it, is about how. So I'll start with the phenomenological aspect. So because the way I understand phenomenology is about starting an analysis from the phenomena you're dealing with rather than from analytic categories, which is as much as possible what I've tried to do. I've tried to say, right, the experiences that I am sort of documenting, this is what there is and what can we do about it, rather than sort of coming in and saying with kind of heavy-handedly with analytic principles and almost playing into what's already there. The aim was to sort of unpick and work from the center outwards as much as possible. So is that resonant with your understanding and sort of where you're coming from with that question?
Yeah, I think I'm talking about even taking it more micro, you know, like really going and getting more subjective, more kind of experience and definition from people. You've obviously started with that with different scenarios. But really, are there commonalities between, like Michael was saying, maybe different groups, even more so, and what, you know, how many people are suffering from these temporal migrations? And actually, you've highlighted some issues, but there's probably 100 more. You know, to be asking people subjectively what's going on for them. But like I say, that would be a big bit of work because you want to speak to hundreds of people.
That is a great point, and I do intend to speak to hundreds of people. I already have in my life spoken to many more than that. So I think, no, I see what you're saying now, and I think it would involve creating some kind of, so almost like a typology of different kinds of experiences. But I think also what it touches on, which is great, is the need to a certain extent, open up the categories that we have for either a total kind of shift or perhaps a recalibration to allow space for new identities to flourish. And through a grounded example like this, that's exactly the best kind of way, in my opinion, you can do that. And I think it's important to stay mindful of that. So going forward with my work, I think your interjection is very useful for me to bear in mind, actually, about how, okay, I'm trying to expose this kind of violence in the way that we impose categories, but to what extent am I actually reproducing that? And what space is there for other identities to flourish?
Great. So we've got there's a discussion going on in the chat about reflexivity in your work, Arthur, and on the kind of problematizing the position of the researcher. So I'll let you read that, and while you're doing that, you certainly don't have to respond to it if you don't want to. But we'll move on to a question from Tiffany for Marcin.
Thanks so much, and for everyone for the rich conversation and discussion we're having. Marcin, I was struck in, I think it was early on in your presentation, and and I was thinking about the precarity of let's call them the gay dads, and from which was mentioned before in terms of needing to perform a certain kind of heterosexuality. But there was also, were you talking about adoption and whether some of the dads, the kids going through adoption and getting to know their birth families, whether that was possible or appropriate. And you said that there was some gay dads who were perhaps hesitant or resistant, and I might be misunderstanding that, because of their own precarity in this family relationship, as to whether they would connect with the birth families. And it just made me think about the difficulties of, and I put in the chat the rights, but I didn't mean, in kind of a legal sense, but you've got the precarity of the the fathers, and then I was thinking about the kids as well, and what they might need, and not making assumptions there. But I wondered if you could say anything more about, perhaps, are there tensions between children and the kind of research that you're doing and the parents, or how that's being negotiated in terms of the different needs that they might have?
Thanks for this question, Tiffany, because it's been one of the biggest themes in this research. On one hand, the precarity of of those families, and the memory that many of those men had of actually not even being able to think about parenting some years earlier, right? And the kind of path that they themselves had gone through to come to this stage where they said, "Oh, is it possible? Actually, maybe it is." And whether it was in a situation where it was completely legal, or in a situation where they somehow did it in a different way, beyond the law, they always thought about this precarity. At the same time, so it was a common theme among all the interviews, which is actually quite a strong finding, given that it's been 3 studies, so in total almost 100 men, and this is very, very strong in the findings, this feeling of precarity. There's also the term precarious kinship that Aaron Goodfellow in his recent book on gay fathers also used, precarious kinship, for this reason precisely. On the other hand, many of those men did actually want to queer kinship in some way, and they actually used some conscious strategies or conscious narratives about, oh, we want to do it slightly differently. We want to, actually be in touch with those families, or we want to with the birth families, or we want to be in touch with the surrogate mothers, or we want to do it in a way that is somehow queer, right? Somehow a little bit, even just a little bit. And this, of course, depended a lot on their specific situation and on the community support that they also had for this. I would say the community support, the community building, the organizing was a very important aspect of all those conversations and negotiations, because the associations, some of which I've mentioned, helped a lot. Those rainbow family associations, how to structure those debates, how to, they provided a forum, they provided experts, they provided spaces for the people themselves to just talk about it. Because of course, another important part of the conversation were the children. In some situations, it could have been dangerous for the children to get in touch with the families of origin, because maybe they came from some situations that did not provide the home for them, right? Or there were some conflictive situations in the families of origins. Not in many, not in all of them. So actually, some children, especially as they were getting older, they did want to get in touch with the families of origin, and it didn't mean that they wanted to return, or they wanted to, kind of leave their gay dads, or they just wanted to know, so simply, and it was fine. So again, the community building and the association somehow helped to structure those debates, and I've been to quite a few interesting workshops and events where the children themselves were speaking about their needs, about their fears, and then the fathers themselves were speaking. And I think this community building was a very important aspect of all the debate. And one last thing to add, I think, is that similar debates might be happening, for example, in gamete donation, right? If children want to know their genetic origins for some reason or not, and in all assisted reproduction in many different situations. I'm not sure that answers your question, but I think it's a very, very important question for this research. So
thank you. You definitely, yeah, thanks. That's really helpful.
Arthur, we now have a final question from Natasha.
Hello. It's quite a sort of kind of practical, concrete question, I suppose, taking us from the realm. I feel like I'm taking us from the realm of the more conceptual. But I guess it's just a bit about healthcare settings and familiarity with healthcare settings. Because I remember not knowing, like aged early 20s, that there was a sort of section, probably a bit of a late developer, but there was like separate thing of like sexual health clinics versus the GP. And I was just wondering whether because if you have a bad experience with a sort of conservative GP, well, I just remember being struck by the difference between, say, a conservative GP versus like a very in a sort of very sex positive sexual health clinic, how that might then impact your use of services and your access to information, and whether someone perhaps not familiar, or even someone familiar with the UK healthcare context, would be put off by a sort of experience where you're basically made to feel sort of, I don't know, judged or whatever, whether you differentiated between those settings, or if people didn't actually reach the sexual healthcare clinic setting that you're talking about.
Yeah,
Thanks.
and I think a lot of us are put off by first experiences. I think to a certain extent, I certainly was. To the extent that, and I'll discuss this a little bit second, but it can go both ways. It might not actually, for some people, be that they prefer going to the clinic. It might be that they prefer going to the GP. Now, the sexual health clinic became a thing in the first place, really as a response, as far as I understand it, became really popularized as a response to the AIDS crisis, because the concerns of confidentiality and family doctors became a lot more salient. You have, therefore, kind of an interesting example of a space of healthcare provision which is siloed off. And what is interesting, I think, is the fact that, okay, you'll often I was speaking to some sexual health practitioners during my research, and they always joke that anything below the belt goes to a sexual health clinic, right? There's nothing really that ties a lot of what they do together, apart from the fact that it's just something you don't really talk about. And interestingly enough, in my experience, I actually prefer, and I'm happy to share this, going to a GP for that reason, to get my sexual health checks done, because I don't feel entirely comfortable with saying, okay, this is a part of my health that needs to be done separately. I am glad you asked this question, though, because I'm planning in my doctoral study to look at exactly this, right? How interactions in those clinics or other spaces of sexual healthcare provision not only put people off from going, but actually shape the sexual identity of the people who use those services, and the extent to which risk or similar kind of constructions becomes part and parcel of the way they understand themselves as sexual citizens. Or sexual citizenship is also another growing kind of area of literature, which temporalities have a massive impact on the way people negotiate that. So yeah, all sorts of different thoughts there in lots of different directions. I think, though, your question is really important. And I think the point that you made to sort of bring it back down to the concrete is exactly why I'm doing this work. So that's exactly the kind of stuff I want to be hearing. So thank you for asking that.
I'm glad you're doing more work in that area. It's great to hear.
Well, hopefully, if people take me. So
I was going to say, I think what we're all saying is that we want to hear more, and we're looking forward to reading the PhD when it's better. Thank you very much. I think we'll stop it there. That's more than enough questions. There's some really good stuff to think about there, I think, and I hope you'll all join me in hopefully turning on your cameras and just thanking Arthur and Marcin for two really great papers. Well, rather sadly, that brings us to the end of the Queer Migrations Conference. And the three of us were talking about it a couple of days ago, and it just really there have been so many unexpected links and unexpected connections between all of the papers. We really have enjoyed every single second of it, and in a sense, I think it really reflects what Geoffrey had said on Monday about queer curations and the idea of lots of different disciplines, lots of different approaches coming together and really unearthing some really productive connections that we might not have expected, and connections that we couldn't possibly have expected. So that's only possible thanks to all of you for giving such wonderful papers, asking such wonderful questions, and being such wonderful audiences. So a huge thank you to all of you. I would also like to say, just again, a huge thank you to CRASSH and specifically Nikki, who has been here throughout, helping us organize, helping us show PowerPoints, share Zooms, etc., etc. So all of the things that we couldn't possibly do by ourselves. So thank you very much, Nikki. And if you might just indulge me in one more thank you, I would love to say a huge thank you to Leila and to Tiffany, who have been absolutely spectacular to work with. And yeah, it's been really fun. So thank you all for coming again, and watch this space.